The annual report for 2016 is entitled Suffolk Minds Matter, and it's all about improving mental health and wellbeing. This report highlights key recommendations that we can all take to improve health and wellbeing.
We all know how important our health and well-being is to us, but sometimes our mental health and emotional well-being gets overlooked in our busy lives and also in the services we provide. That's why in this year's public health report, Suffolk Minds Matter, we focused on mental health and emotional well-being throughout the age ranges. In the report, we've developed recommendations for what we can do to help ourselves and what we can all do working together to improve mental health in Suffolk. In the film, we're going to see what people across Suffolk are doing right now to improve their mental health and well-being.
Well, my name's Ellie, and I helped start the Better Together group. I am a military wife, and I moved to the area. There wasn't a lot going on at the time, particularly for military wives. I work, and so I found that the few things that were on didn't coincide with the days that I was off. And so I got involved with the Children's Centre and helped to start it.
So we run a stay and play cafe, and it's a chance for the children to come and socialise with other children, and for the parents to come and socialise with each other. We often have sort of conversations with parents about mental health and things, and a lot of them feel more comfortable talking to a professional than maybe sort of friends and family. So it's really good that they get the chance to talk to people here.
My children are grown up, but I've just recently became a legal guardian of my nephew, and he's only 22 months at the moment. So obviously I went from having lots of friends, a job, to being at home mum again. So coming here every Monday has been a lifeline to me.
Mindfulness is a simple form of meditation or mental training that's come to prominence in the West because it's been shown to have particular benefits for health and well-being. People tend to learn about mindfulness through guided meditation exercises and then practicing and applying mindfulness in their daily lives. The mindfulness sessions have been running for about a year now after we completed a pilot program at various sites around the county. And they were set up really to give staff an opportunity to practice mindfulness if it's something they already know about, but also to find out about mindfulness and to learn more about it. And to give them a space in the day where they can sort of recharge and reset for the afternoon, so hopefully that they find that it has an impact on how their afternoon goes at work. It helps develop emotional resilience. There's really interesting brain studies that have shown that people who practice mindfulness have increased activity in a particular part of their brain that is associated with approaching difficult situations, difficult thoughts and feelings rather than avoiding them.
Key Place is a place for everyone. It's a place where people can come and meet, whether they can come and discover about history and heritage and about themselves, or just come and be in what is a very inspiring and beautiful place. Well, we feel that everybody, as I've said, has these emotional needs, and if they're not being met, that's when you get unwell. And so our focus is on preventative ways to enable yourself to feel better and to stay well. So if your emotional need for a place for reflection or a time to relax is not being met, then we'll try and offer that here. So it's about giving people the tools themselves to improve their own emotional well-being.
The Med Sheds is about getting groups of men together, working together, socialising together, and doing things, building things, making things as a group. We certainly achieve all that here. We have a good laugh. In fact, sometimes too much, and we're not doing as much work as we should, perhaps. But for me as an individual, I'm new to the area, and for me it's a great place to come and meet new people, make new friendships, and that's coming on really fine. We have got members who have suffered bereavement recently, and they found this is a good place to come twice a week, and they can spend some time socialising. We've had some referrals from doctor's surgeries as well that have come along. And like I say, generally we're all getting on really well, and we're doing something. There's a purpose for being here. I think the main thing, it takes their mind off of what maybe their troubles, maybe their problems, because they're doing something else, and they're not doing it alone, they're doing it with other people. And I think it's important, that social contact that they get from here, to take their mind off things. I think it's important to come to a place like this, because it gives you an opportunity to express yourself and be more part of something rather than be on your own. And being part of something helps not only yourself but helps the group, and we're all contributing to that by being here together.
As you have seen, there are plenty of outstanding examples around Suffolk demonstrating how we are improving people's mental health and well-being. To support and build on this work, we have set out 7 priority areas in our report which determine how health partners in Suffolk can work with communities to make the greatest difference. To work to promote mental health and to reduce stigma and discrimination. Promote emotional well-being and resilience in communities throughout Suffolk by working to address the social determinants of mental health. Ensure those with physical health needs have good mental health, and that those with mental ill health have equal support to improve their physical health. Promote the mental health of women and ensure children have the best start in life. Ensure the effective recognition and treatment of depression in older people, especially those at increased risk. Work to promote active, healthy ageing programmes to delay the onset of dementia at any age. Reduce suicide in Suffolk by 10% over the next 5 years, using the 2012 to 14 data as our baseline.